Here are top 5 things you need to know about black fungus. Number 5. What is black fungus? Mucormycosis or black fungus is an aggressive and invasive fungal infection caused by a group of molds called mucormycetes. The common name, black fungus, is in reference to the blackening that is characteristic of the disease. It can affect various organs but is currently manifesting as an invasive rhino-orbito-cerebral disease, affecting the ear, nose, throat, and mouth. It is not contagious but can cause a lot of damage internally and can be fatal if not detected early. It affects the sinuses, the brain and the lungs and can be life-threatening in diabetic or severely immuno-compromised individuals, such as cancer patients or people with HIV, AIDS. Number 4. How does the disease affect the patient? It begins to manifest as a skin infection in the air pockets located behind the forehead, nose, cheekbones and in between the eyes and teeth. It then spreads to the eyes, lungs and can even spread to the brain. The disease can develop after the fungus enters the skin through a cut, burn or other types of skin trauma. It leads to blackening or discoloration over the nose, blurred or double vision, chest pain, breathing difficulties and coughing of blood. Number 3. Who are contracting black fungus? COVID patients undergoing oxygen therapy in ICU, where a humidifier is used, are prone to fungal infections because of exposure to moisture. Conditions such as uncontrolled diabetes, weakening of the immune system due to the use of steroids, prolonged ICU or hospital stay, voriconazole therapy, used to treat serious fungal infections, in COVID-19 patients increase the risk of mucormycosis black fungus. Number 2. Necessary precautions to prevent black fungus. As people catch the infection by coming in contact with fungal spores in the environment, people have been cautioned against having exposure to decaying bread, fruits and vegetables, besides soil, compost and excreta. Wear shoes, long trousers, long sleeve shirts and gloves while handling soil gardening. People must maintain personal hygiene and thorough scrubbing is recommended while bathing. The disease can develop after the fungus enters the skin through a cut, burn or other types of skin trauma. Discontinue immunomodulating drugs and infuse normal saline before amphotericin B, an antifungal medication, infusion. Patients should be monitored clinically and with radio imaging for response and to detect disease progression. The blood glucose level should be monitored post-COVID-19 discharge as well as regular examinations to find any warning signs. Number 1. What is the treatment for black fungus? After infecting a person, the fungus doesn't remain static but spreads through the nose, attacks the eyes, and eventually reaches the brain, at which point it becomes potentially deadly. This necessitates multidisciplinary expertise to treat it. In a majority of cases, especially if undetected for long, a number of different parts end up getting affected by mucormycosis. So it calls for a combined team of microbiologists, internal medicine specialists, intensivist neurologists, ENT specialists, ophthalmologists, dentists, surgeons, etc.